Okay, so we're back in. So, Dr. Raphael, I was thinking it'd be neat if we could go a bit into the history of orthodontics and
Yeah,
how there's been this struggle between extractionists and expansionists, for almost 100 years or more now. And 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 I guess where you see the field should evolve given the history and
yeah.
and where it should be going forward.
I've been in this profession for a long time, and I've seen both within my career and also historically, the profession tends to polarize around certain issues.
Okay.
The extraction, non-extraction issue is well over 100 years old now.
Okay.
The debate about whether you should start early when there's still baby teeth or later when it's just permanent teeth is an issue that's maybe not quite as old, but I'm going to say, has come to a peak in the last 20 or 30 years.
Mm-hmm.
And I think all these polarizing issues would go away if we had a better sense of what is causing the crooked teeth to begin with.
Mm-hmm.
That, in a way, the extraction, non-extraction debate is a red herring for the idea that facial growth is about the way the maxilla is developing, and that's a result of soft tissue dysfunction. I think once you get a handle on that particular concept and see that as I like to call it the string theory of malocclusion. The string theory in physics is that theory that unifies all knowledge, right?
Mm-hmm.
About the universe. Maybe this isn't quite that dramatic, but the string theory of malocclusion is maxillary dysplasia. That no matter what the angle classification is, whether it's crowded or not, this is all about the face not developing the way it's supposed to. Well, when that's the problem, then, there's just no question about whether you should be taking out teeth or not. No, you shouldn't, as long as you can get there early enough. You want to help the face grow properly.
Mm-hmm.
And when you do, those they seem to be meaningless issues to me anymore.
Hmm.
Now, I know orthodontics has progressed quite a bit in recent years. Braces themselves have become lighter and more gentle. They're more efficient. Even the so-called modern extractionists don't extract teeth all that much anymore. There was a big conference in 2009 where the extractionists and non-extractionists were pitted against each other
Wow.
in an open forum.
Yeah.
And it got quite heated at some points. But at the very end of the conference, somebody asked the panel right across the board, how much do you take out teeth? And everybody said 5 or 10%. I mean, 10% was like the worst.
Right.
And 5% was the best. And now with early treatment, it can be even better than that. I mean, there's almost no reason to take out teeth if you can help the jaws develop in a timely fashion.
Hmm. Okay. I know it's late there for you. Anything else you want to add, or you want one thing that the parents can take away and that you think is important to let them know right now?
Well, we never really talked about the various techniques that are involved.
Let's talk about that.
Yeah, so let me address that just a little bit.
Okay.
And I probably parents won't find too much satisfaction with this answer because everybody wants to know, well, what appliance are you going to use, and how long is it going to take, and so forth. So I'm going to answer it though in a much more general way,
Okay.
and that is you have to address both form and function in your orthodontic treatment planning. So form is the shape that the teeth are aligned in, the jaws have taken the way the bone bones are oriented, and function is about the movements and activities of the face and mouth that determine how the bones are going to grow. So braces is a form technique. BioBlock is a form technique. Cranial osteopathy is actually both form and function, but in large measure a form technique. Myofunctional therapy is a functional technique. It teaches good oral rest posture. There are ways to teach children how to breathe through their nose when they're not used to doing it. There are ways to teach a child how to keep their nose clean. There are ways to teach a child how to stand up straight, sit up straight, and adopt healthier habits all along. Good orthodontics should approach both form and function.
Okay. Okay. So thank you. Thank you. I guess the big takeaway for me is do not compromise the space of the tongue. Maximize it.
Yes.
Make sure that the jaws grow wide enough and forward enough. So that means looking at a kid early and so start breastfeeding so the tongue muscles start to work, which keeps the tongue up. The tongue is a scaffolding for the maxilla. The maxilla will grow properly if the tongue is resting up there with good oral rest posture.
Yep.
Make sure the kid's mouth is shut and they're breathing through their nose.
Yep.
Chewing tough foods earlier builds the jaw muscles and helps widen the palate.
Yep.
And avoid anything where a kid's growth is being limited through retainers or growth is being held back or the upper jaw is being pushed back or limited through headgear or temporary anchorage or something else.
Right. Right. Remember, don't villainize the technique so much or the appliance so much. You have to have growth going in the right direction. I think you got it. I think you got it right there, Omar.
Okay. Thank you very much for this interview. I think parents will really appreciate that. Their exercises and their habits and there's preventative measures that they can do to improve their kids' airways and faces and I think that's new. I think that's a new thing.
Yeah.
For a lot of people.
I'm going to say this as a general the people that are involved in this kind of orthodontics, we are trying to create protocols that are engaging for kids, that are a little more fun, that are, it's sort of like education, right?
Yeah.
Good preventive medicine is more about education and changing behavior than it is about pills or surgery or braces or any kind of mechanics, right?
Yeah.
And that's going to be our challenge in the 21st century.
Yeah.
Is how are we going to convince ourselves that we are responsible for our own health, and we will have the solution for it.
Yeah. And we're also responsible to teach our children.
Yes.
Yeah.
Absolutely.
Yeah. Thank you. So I'll end the recording. And, so we're going to end there. Thank you.